This is the manual posterior capsule stretch. In this case, the way the setup is, we're going to be stretching the left posterior hip capsule. So the person is on the left side lying. This bottom knee here, the left knee in this case, is bent at 90 degrees, the knee and the hip. And then the top leg, the right leg, is straight. Everything is nice and in line. So kind of from the shoulder, the hip, and even to the malleolus, you should have a straight line. So it's going to be kind of more like that. Some of the mistakes you'll see in this stretch is the person, the practitioner, will kind of create all the rotation through the thoracic spine, doing something like that, which is not going to help the person get into the posterior hip capsule. So we're basically stretching the posterior hip capsule by moving the acetabulum on the femur, and not the other way around, which is traditionally done in most joint mobilizations. So we can keep something under the bottom knee to increase the stretch. For people who are really tight and restricted and have some hip impingement-like symptoms, that might not work. So if you feel any pinching at any point during the stretch, you have to modify your position or alter it in some way. So what I'll do is I'll position myself here behind Mike. I'll have you straighten your right leg a little bit more if you don't mind, but stay kind of as relaxed as you can, good. And then I'm just gonna put my body weight on the right hemipelvis here. I'm gonna lean over so that the person, I'm basically putting the person into left acetabular on femur internal rotation. And if I want, I can even take this bottom knee here. So I'll hold myself on the table to stabilize. I'll pull that bottom knee into a posterior glide. So the person should feel it in the back and the side of the bottom hip, in this case the left hip. A lot of times you'll see this will kind of pop up in the air if the person has a lot of posterior capsule restriction. So you can hold that down, just brace yourself on the other side of the table, put your body weight into it. You can spend 10 minutes here and not fatigue yourself because you're just leaning. Any kind of pinching at all, the person complains, you can either remove this, or a lot of times you can kind of change your vector. So if I kind of distract inferiorly a little bit like that, and then push the pelvis into left acetabulum on femur internal rotation, that'll reduce a lot of the pinching symptoms. So just play with that, but at no point should there be any pinching.